Hi there. My name is Thea Megas, and I'm the owner of KAYDA HEALTH Therapy Clinic in Coquitlam, also available virtually across British Columbia. And this is a very short introduction to EMDR, which stands for Eye Movement Desensitization and Reprocessing Therapy, which is a type of therapy that many of the registered clinical counselors on my team at KAYDA HEALTH offer. It's an amazing therapy. A lot of clinicians will say things like it's the closest thing to magic that I know, and a lot of clients will kind of say the same thing. And it sounds probably a little bit quirky or wonky when you kind of hear how it works. But I really want to highlight that it is so evidence-based. There is so much research at this point that shows that EMDR is an incredibly effective, highly beneficial type of therapy. And it's also just really cool. So to talk a little bit more about what EMDR is and how it works, I'm kind of going to go into that in a minute here, but I do want to highlight that it was generally built on the idea of treating trauma, and then it's kind of branched out from there over time to be a type of therapy that can be used for almost any kind of concern, issue, presentation that you might have. And the training required for basic EMDR requires you to have a really solid educational foundation already, so usually a master's degree or higher, and it's a 5-day training for the basic training. So that's a lot of extra hours that go into becoming able to offer this type of therapy. So I just want to highlight, it's not something that if somebody's offering it, it's not something that is easy to be able to offer it. You have to have done quite a bit of different background training and work and that sort of thing. So I'm going to talk in a minute about like what it looks like in practice or that kind of thing. But just to start with, essentially any concern that you have, if you have an EMDR therapist, they might suggest trying EMDR to address that. And there could be all kinds of different reasons that they might suggest that. There are very few conditions where EMDR would be counterindicated at this point. There are conditions that many would say you do need to have an EMDR clinician who's trained in applying EMDR with that particular concern. So like OCD would be maybe one of those because it requires a bit of a different approach. Panic might be another one. Anyways, there's a few different ones. So basically though, if the way that I usually bring the idea of EMDR up to people, if they haven't kind of come looking for it to begin with, is I sort of say, if you logically know that something that happened in the past, that it shouldn't trouble you anymore, or that you should have moved on, or like that it shouldn't bother you, but you feel an emotional or bodily disturbance when you think of it, and maybe have some poor self-talk around it when you kind of look at it from the here and now, those are good signs that there's some sort of cognitive dissonance that's not very helpful, where EMDR would likely be beneficial, because EMDR does not work with well, it actually does work with the logical side of things, but it really is based in working with your emotional system and your body system versus staying just in the cognitive domain, which is where lots of other therapies really spend their time and kind of thrive. So to talk a little bit about like how EMDR typically progresses, traditional EMDR puts a really strong focus on making sure that people who are engaging in EMDR have really good grounding skills to start. And so the process, EMDR has 8 phases, and they talk about it differently than how I'm going to, but I'm going to talk about it in sort of like layman's terms. So like the first step is actually getting to know the person, like making sure you understand the client, their background and their concerns. So you should expect, if you're engaging in EMDR, you should expect that your clinician is going to take some time to understand where you're coming from, how you got to where you are, and where you'd like to go. Like that's part of any therapy. So you should still expect a pretty thorough intake and assessment process, even if you go into therapy wanting just EMDR. Beyond that, the next stage of EMDR is really ensuring that somebody has good grounding skills. So grounding, I would explain as being able to come into the present moment the present space and the body. So things like breathing exercises are good examples of grounding exercises. Yes, they don't work for everyone. There are lots of different ways of doing grounding. They can be very simple ones. So I often show clients how to do a simple hand massage to just really bring focus and attention back to the body. And also perhaps it might be a sort of a soothing experience for some people. So progressive muscle relaxation might be another one where you're kind of going step by step through the body and little by little creating tension and release throughout the body. So again, you're bringing attention back to the body. Grounding, I would say, it doesn't, I think there's like a little bit of a misconception that grounding should feel good. And I would say it doesn't actually always feel good, but it is meant to bring you back into the present space and time, and kind of take your attention away from whatever might be pulling you into distressing situations. Will it negate entirely if you're in a really stressful circumstance? Probably not, but it should give some abatement of the symptoms that you're experiencing for at least a short period of time. And so sometimes the reason I say it doesn't necessarily always feel good is sometimes it feels quite boring for people. Like sometimes it's very much like, oh, like this breathing exercise is not exciting. That is true. It's not the point. The point is not to be doing something that necessarily is very joyful or exciting or invigorating or something like that. The point is just to be settling into the space and current space and time. So working on grounding, there's lots of different ways that you can do that. That's the first step. We want to make sure that people have good grounding skills before they progress in EMDR, because when you go out of the EMDR therapy session and back into your day-to-day life, we want you to be able to take care of yourself. And also in sessions, if people get kind of too activated, we need ways to bring people back safely into their body and their space. So that's pretty much why, the way I explain it, that we start with grounding. Once we know somebody has good grounding exercises or grounding abilities, I should maybe say, then we can move on to stabilization. So stabilization often sounds very similar to grounding, because it's meant to kind of create that same thing, like bringing you into a sense of like neutrality or calm, which is often what people think will be the result with grounding, and it may be. But stabilization, the way that I understand and explain it, is that it requires a bit more of use of your brain. You have to think about it more than what you do with grounding, right? So with grounding, you don't really have to think too much to do the breathing or other various things that you can do for grounding. For stabilization, you do. Now, there are some really specific techniques that different EMDR therapists are trained in and will teach their clients as part of stabilization. And so this part is going to depend a little bit on who you're working with and what they offer. Some really common EMDR stabilization techniques, one would be called container, and that's the idea of creating a way to contain something until you're ready to work with it. And again, clinicians use this really differently and have different opinions on what is and isn't appropriate for container, but there are ways to use it for thoughts, for memories or situations that are troubling, for even emotions, or sometimes people even have success using it for managing pain or chronic pain symptoms, that kind of thing. So it's just being able to put things away until you're ready to work with them. So people often will ask, like, well, isn't that avoidance, or isn't that I mean, basically avoidance is probably a good way to say it. So, and it is to a degree, but it's kind of like a healthy avoidance, because you're putting away with the intention of coming back, not with the intention of getting away from it entirely. Which is pretty important, right? So it's kind of like you're almost putting it on the to-do later list versus the like. So when I work on building a container with people, I tell them part of the process here is that you would say, like, I need you to think of a container and tell me about it. It has to be something that has a two-way system. You have to be able to put things in and you have to be able to take things out. So like an envelope is fine, a book is fine, a garbage can is even fine, an incinerator, not fine, a shredder, not fine, a fireplace, not fine. So things that are going to destroy what you put in it would not be a container. That's something else entirely, that I don't have a word for. I don't know of anything in EMDR that is like really that. So That's container is one very common stabilization technique. Another very common stabilization technique is peaceful place or calm place or safe place. You can use the term differently. This is kind of the idea that you're going to be able to connect with a sense of peace or calm or safety, kind of regardless of what sort of situation you might find yourself in. So it's not to say that you're going to be able to sit in the middle of like a very challenging, disastrous situation and just feel completely relaxed and at ease and zen. That's not really the goal nor the expectation, but it is the idea that instead of kind of going into a full panic response or anger response or whatever other kind of response you might typically find yourself in if you're in an activating or triggering situation, that you're going to be able to sort of almost like the idea is almost like being able to take a breath, connect with a sense of calm or peace by having this connection with a calm, safe, peaceful place, and then proceed differently because you were able to do that. So again, sometimes it's hard because people will have sort of a sense of like, but you know, the thing I'm going through is really, really stressful or uncomfortable or challenging, so I don't think it's going to work. And again, if the goal is to feel completely calm and neutral, yeah, it's not going to work for that, but it should allow you to sort of like, as a colleague of mine says, like to contain yourself in some way, right? To like manage yourself better through that situation to some degree. And that's what we're looking for there. Some other ones that are common would be something called light stream, and this is kind of the idea that you can connect with a color that you find particularly healing or helpful in some way, and that you can kind of see that color as a light coming down to, into your being and sort of providing you with healing or calm or soothing or whatever you might associate that light with. So these ones, as you can hear, they all use like a bit more imagery. This is another common thing that people ask about with EMDR is around, well, what if I struggle with imagery? What if I can't see in my mind anything? It's fine. It makes it like a little bit more challenging because a lot of the language of EMDR is about like, so tell me what that looks like, or picture it, or something kind of along like, you know, what kind of imagery are you seeing now, that sort of thing. And you don't actually have to see the imagery to be able to describe what it would look like, right? So it's kind of like however it sits in your mind is probably the better way of languaging things. But anyways, what I'm saying is you can work around the lack of ability to see within your mind if that's a concern for you. I always forget the word for that. I'm not good with the the technical Latin-y sounding words. I tend to avoid them in my practice, actually. Anyhow, so we've got grounding, then we've got stabilization, and then typically we move into what's called desensitizing and reprocessing. And so the idea here is the things that, I have to give a little bit more background to talk about these. So in EMDR, what we're kind of looking for when somebody comes in and they say, you know, I want to, I'm really struggling with panic attacks, for example, and I want to address that. So the question then becomes a little bit of like, well, where in life have you felt that way? And EMDR typically relies on the idea that there are times in life that maybe are not logically the same. So not like exactly the first time that you had a panic attack, but maybe the first time that you had a similar feeling, right? So maybe you wouldn't call it a full-blown panic attack, but like if you were 2 years old and something horrific happened around you and you had feelings you associated with panic, you might not even remember it clearly, but you might be able to say, well, I think it would probably be when I was 2 because I heard the story from my mom about how I was hyperventilating and I couldn't stop crying or something like this. So EMDR is looking for sort of the history of events that have accumulated over time along the same emotional thread. So if the emotional thread here is panic, we're looking for what was the first time you felt that way? What was the worst time you felt that way? What are other times that seem significant where you felt that way? What's the most recent time? What are future times where you think you're going to feel that way? And what we want to do is we want to take all of those and treat those as situations or memories. Even the ones that are future, we still treat those as memories because you can kind of conceive of them in your mind. Again, it might be as an image, or it might, if you don't see images in your mind, it might be differently, but you conceive a situation in your mind that hasn't happened yet, and you're kind of like playing that out in your mind in some way. So because you're able to do that, and then you can remember kind of the details of what you imagined there, that counts in EMDR as a memory, essentially. It counts as something that is adding to that bank of all the things that add up along that panic thread and cause you to feel more panicky, more likely to have panic attacks. So we want to get the collection of all of those things, and there's different theories on which of those you want to start with. That kind of depends on the clinician you're working with. Personally, I like people to be able to build a bit of like confidence and capacity in the EMDR process, so I wouldn't typically start somebody with their worst one. But if they really felt like that was where they wanted to start, then I would explore that with them, and we just make sure we had really good grounding and stabilization to get through that, or we were modifying the EMDR in a way that actually made that attainable, essentially. Okay, so desensitizing, reprocessing, what does that mean? Essentially, that means that we're looking to make that collection of related situations. We're looking to decrease the vividness that we kind of hold them with, and we're also looking to decrease the emotional intensity of them. And then the reprocessing is we're looking to have sort of like a different way of thinking about them. So in EMDR, a lot of times we use phrases like, so when you look at that from the here and now, that moment in time when you were 2 or whatever the situation, when you look at that from the here and now, and you know, what's the worst part of it? What are the emotions that come up with it? Where do you feel that in the body? What are the words that you are maybe saying about yourself in that situation? Maybe you're saying like, I'm worthless, or right, or like, here I am abandoned again, or something like that. So you have a story you're telling yourself, and it has the word I in it almost always. And even if like when you were 2, you probably didn't know that phrase, but it's when you're kind of looking at it from the here and now, and you're attaching this negative belief to it. So we like that in EMDR. We like to know what negative belief we're working with. It actually helps to kind of activate the situation or the memory. And when we activate something really, really well, that's what helps. There's kind of a couple of things that I'm going to talk about here that help with actually processing things in EMDR. So the first thing is you have to be kind of motivated to be able to do it, right? So it's not like a one foot in the door situation. You have to be really willing to work with your clinician and engage in EMDR. And that sometimes can be challenging, especially if you're somebody who maybe has a strong interest in being really in control of things, or doing things really, really well. Sometimes there's some hurdles to kind of like figure out there, but that's a little bit of a sidebar. I won't go too much more into that. But you need to want to kind of get rid of this issue, right? That's important, and you have to be willing to engage in the process to do that. So that's sort of like part one. The second thing that you need to do is you need things to be activated enough that they can process. So if something is kind of like, if you have a scale, we use the scale a lot in EMDR. If you have a scale where 0 means you feel totally calm and neutral about something, and 10 means it's the most disturbing it could possibly be to you, we typically want people to be feeling it at like a 5 or more out of 10 to start, because that means it's activated enough to actually do something with it. If you're already seeing it as like a 1, 2, 3, 4, then you're already kind of seeing in a way that it's not probably super, super troubling. It may still be that you want to address that, but typically if it's kind of that lower range, it's not going to be impacting your function, your day-to-day. And yes, this gets asked too sometimes, is like, are people accurate in that self-assessment? Like, is it truly a 1 or a 2 or a 3, or is it actually that like people are just put up a bunch of protection and walls for themselves so they didn't have to experience it anymore, but when they kind of like let that down a little bit, that they turns out, yeah, they're actually like an 8 or 9. Yeah, that happens in EMDR, and sometimes that worries people, because once we start asking things like, what's the worst part of it and where do you feel that in your body, that wall kind of drops a little bit, and then suddenly people who were saying, well, it's a 3 out of 10, now they're saying it's like an 8 or 9 out of 10 actually. Like, it gets really, really big. And sometimes that worries people, because it's like, well, I thought I was doing this so that I would like feel this less, and here we are seeing that like this number is actually going up higher. We're not really worried about that, because we want that initial activation. But then this is the next thing we want to do in EMDR, is we want to add a lot of distraction, and that distraction combined with that activation and that motivation, that seems to be where the magic in EMDR essentially happens. So that distraction can look really, really simple. So I have a rock here, for example. So if I'm working with somebody in EMDR, I've got them thinking about the situation. They're quite activated because I've asked those questions and kind of built that up right there. And then we're going to go into adding the distraction. Usually in EMDR, it's called either bilateral stimulation or dual attention bilateral stimulation. I just call it distraction because that's the easier word, right? So we're trying, and the clinician is really going to provide a great deal of distraction, depending again a little bit on the kind of EMDR that the clinician is using. They're either going to tell you to like keep the situation in mind as much as you can, but also like focus on this dual attention bilateral stimulation, or they're going to say just you try your best to keep hold of that, and I'm going to distract you as much as possible, and I hope I win, depending again on kind of what kind of EMDR they're doing. Anyhow, so it can look very, very simple. Very common, the way EMDR got its name, maybe I should start that way. The way that EMDR got its name was based on the idea of eye movement. So the person who created EMDR, Francine Shapiro, the story goes, I believe, that she was out for a walk and she noticed her eyes were moving back and forth as she was trying to think about something, and she kind of went, I wonder if there's something to that. And then she started to create this therapy that relied on the idea of people following back and forth with their eyes, fingers, or I don't have it in front of me, but I have a little wand thing I use sometimes, or some people use light bars or different technology. There's lots of different ways to make the eye movements track back and forth. So that's one very common way. Some people, the eye movement works really well, and you can do that, and you can adjust things like the pace of it. You can adjust things like how far away from somebody you are when you're doing the eye movements. You can adjust what you're using for the eye movements. I usually just use my fingers, or like I say, I have a little wand thing. And you can add some other elements in. So eye movements is what it was built on, but there's lots of other ways to do it. And again, depending if you're doing it virtually or in person, or what your clinician offers, what is more workable for you as a person. It might be something like a rock or other object about this size, and you might just be passing it back and forth, or you might be gently tossing it back and forth, something along these lines. And this is going to take so what happens, and this is something that is explained in a little bit differently in standard EMDR versus EMDR 2.0, but I like the EMDR 2.0 version, so that's what I'm going to talk about. EMDR 2.0 talks about we use our working memory, and our brain is using our working memory to hold on to all those situations that we talked about earlier, and have built up. The working memory is holding on to those in a certain way. And the brain can only do so many things at a time. So for some people, simply passing something back and forth and trying to think of that at the same time, it's going to be too distracting. They're not going to be able to hold on to that memory in the same way. That memory is going to start to degrade. So it's going to, if it's a visual memory, you might lose some color, or sort of lose some pixels, or become blurrier, or feel further away. Those are all really common things that people start to talk about in EMDR. So you might do it with passing a rock or something like that back and forth. You might do it with tapping, is another really common way, and there's different ways that you can tap. There's different things you can say while you're tapping. You might have two little things that you hold in your hands or you put in your pockets, and the clinician has some technology that makes those things buzz or beep, or a combination thereof. You might do something like some kind of drumming, so you might have a little drum pad or something and expect to drum in a certain pattern, and that can be, for me, can be pretty challenging. So there's these different ways, and you just kind of figure out with your clinician which of those work, and some of them might work better for some situations and some might work better for others. Anyways, so through this combination where we've really activated something, and then we've added in this big distraction, so the brain kind of has to pick and choose, like it can't hold on to both. It's usually, like, the hope is that the clinician is going to be able to create something that's distracting enough for you that your brain is going to have to start letting go of that memory. That's where you're going to start feeling less and less of that emotional intensity. So when you check in on that scale again, you're going to find that it's dropping bit by bit, sometimes quite dramatically, hopefully down to zero. The goal of EMDR really traditionally has been to get down to a zero in terms of how intense something feels. However, that being said, what I do and what many clinicians, to my understanding, do is we'll ask if the SUDS, we call that SUDS, subjective units of distress. So if that score is no longer dropping down, it's gone as like, it's staying at like a 2 or a 1 or maybe even a 3 depending on the situation, I'll typically ask whoever I'm working with something along the lines of, so would you say that that's sort of a normal level of distress or disturbance for somebody to have about the situation that we're working on. Because if they say, yeah, it is, and if you kind of say, well, do you think it can go any lower? And they say, no, I don't think so. And you say, is it because of other situations that we haven't processed yet? Or is it because you think that's appropriate? And they say, yeah, it's appropriate. Then for me, I consider that to be complete with most people that I work with. Sometimes though, just in saying that, you add in another round of distraction and it drops a little bit further. And sometimes that's quite surprising. I remember when I first did EMDR, I'm not like, I don't like being 100% black or white kind of thing, like on either end of a scale. And so I was like really, really adamant that I would never go down to a 0 on whatever I was working on. And I remember actually being so like happy but mad at the same time when in a follow-up session my clinician asked, so where are you at on that scale now when you think of that situation that we worked on last time? And I was so mad because I was like, it's a 0. Like I was so upset by it because I was like, I don't want to say 0, but it is a 0. And it stayed a 0. So sometimes you see things like that happening as well. Anyhow, so that's the process of EMDR. It's not always clean. It is distinct from other therapies in the sense that in other therapies, you're typically doing a lot of talking and kind of checking in, and EMDR doesn't usually look like that. It usually looks like getting somebody quite activated and then saying like, okay, so now just keep that in mind, noticing your body and go with that. And then they pass the thing or they do whatever the distraction is. And then you say, okay, let's pause there, maybe take a little breath. And then what are you getting now? And they'll say something like, I'm thinking of when I was 6 years old and I went to the candy store or something. And sometimes people want to explain it, right? They want to tell you like, and I think the reason I'm thinking that is blah, blah, blah. Most of the time in EMDR, we're not going to go down that path because we don't want to allow somebody to be going into the logical side of things. So when you start to explain why, you're really like defaulting over to the logical side, and that's lowering the activation. We want that activation to be able to process, right? So instead of like sitting and having a chitty chat back and forth around like, oh, like, why do you think that? Or, what do you think is that about? You're really going to be like, okay, let's just go with that. So, and then we pass again, and then we pause again. Lots of things can be going on during that passing or tapping or whatever the distraction that you're doing is. And the client's job during that time is really just to sort of be able to notice what's coming up for them. So that might be thoughts, emotions, images, sensations. It could really be anything at all. And then report back to it. And depending again, like how the clinician is doing EMDR, the check-in on that can be a little bit different. It can sound like, in a big general, like, what are you noticing now? It can sound like when you think of the situation we started with, however it now sits in your mind, what are you getting now? Or what's coming up now? What's changing? And it could also just be passing back and forth and then checking in. So when you check in on that scale 0 to 10, where are you now? Now, once that score is as close to 0 as it can go and nothing new is coming up or changing anymore, that's the point where you're typically going to switch over to what we call installation in EMDR. And that's, what I would say it is it's kind of coming back to the question of when you look at that situation from the here and now, knowing that you maybe had this negative story that you've attached to it, whether you were super aware of it or not before the sessions, but knowing that that's how you were thinking of it, how would you prefer to think of it? Like, what would you like to say to that little like 2-year-old you who maybe you previously felt like was worthless because they felt abandoned in that situation? So maybe the thing that you'd like to say is that something like, I am worthy and valuable and deserve to be loved. Right? Something like that. So it's really specific and kind of unique to the situation. Probably one of the most common negative belief balanced out with positive belief that I see in EMDR is something along the lines of like, I can't handle, or I can't manage it, or I can't cope, or something like that. But then the positive belief is simply like, I can manage, I can cope, I can do hard things, something like that. So that's what we see with the bringing in that positive belief. And then you do a fair bit, again, depending on the clinician, but you do a fair bit of work with that positive belief to try and really help your brain kind of connect whatever is left of that situation with that newer, more helpful, more adaptive belief. and then be able to sort of almost see yourself, again, depending on the clinician, how they do it, but be able to see yourself moving forward in life, using that positive belief in different ways. So in the work that I do, I have people picturing future situations, so things that haven't happened yet, and sort of running through how can they see that situation happening, not focused on what is happening with the people around them so much, but like for what's happening with them when they really connect with that positive belief, and kind of pull that into it. So that's the process of EMDR overall. Just checking my little list here to see if there's anything else. So one thing that I did want to talk about is what does this feel like if you're the person experiencing it? There are really varied responses to EMDR, and there are ways to modify it depending on what is sort of tolerable or accessible for any individual client. Sometimes EMDR really, because it activates something that you're not used to usually getting super activated about, like as I said kind of earlier, most people have a little bit of like a wallop or something like that. It can be very, very overwhelming. I almost always describe it as it's a bit of a marathon. So we're using all the parts of the brain when we're doing EMDR, and we're interacting with something that is very emotionally charged, at least initially. So you can often feel like really, really big emotions coming up during EMDR, emotions that you may not usually get as connected to when you're thinking about that situation. And sometimes too, though, you can have quite a bit of fun. I have lots and lots of sessions with people where we're actually laughing quite a bit. And often that has a little bit more to do with like the way that we're doing the distraction techniques. So if I'm making people like spell things backwards, or throw a softball back and forth across the room with me or something, and we're like crawling under couches to get it, like that kind of thing, that becomes kind of funny and humorous. But it can also be, we go through a lot of Kleenex in EMDR. So how it's going to be experienced is quite subjective or different for each person, I would say. But again, we start with the grounding and stabilizing so that you have ways to take care of yourself outside of session as much as you need to. And we use those in session as well, right? So one of the things that really distinguishes EMDR from other types of therapy, at least the way that I was trained to do it, is that every EMDR session with somebody, I say like, okay, let's remember you can stop at any time. You can tell me that by putting your hand up like this. You can use our magic word that I'll absolutely know means stop. And I don't usually like to rely on just the word stop alone, because that's part of a lot of people's stories, especially if it's something traumatic, like I wanted the car to stop, or something like that, right? So anyway, so we have a magic word that we use instead if somebody really needs to. And we have the hand signal because sometimes it's hard to access your vocabulary when you're activated, and you are activated during EMDR. Now the good news is that EMDR, it seems the research kind of consistently shows that it tends to work more quickly than other types of therapy, and to provide a better longer lasting resolution than therapy that relies more just on like thinking your way through things. And that's really good news. People often will say, like, how many sessions is it going to take to deal with XYZ situation? I don't know that anyone has a really great way of interpreting that, but I sort of, it's not 100% way to think about it, but I often think like, well, how many situations have contributed to this thing? And if you have like 100 situations on your list and you feel like you need to process all of them, then yeah, that's probably like at least 100 sessions, maybe a bit more, because some of them are probably stickier. And maybe it's a bit less if a few of them, because sometimes what happens is when we process one situation on that thread, we find that, oh, now a bunch of the other situations, they kind of lose their charge too. Like they kind of get taken care of in that same sweep almost. So it's really hard to know. I typically tell people to expect like a minimum of 4 to 6 sessions for something that's sort of like a single incident, pretty straightforward kind of a trauma. If something's ongoing, it again takes more time because it's ongoing. So you're kind of like fighting against the reality of the world in a way. But yeah, there's really no set time. Therapy is like that though, right? Like just like any other kind of therapy, like you just need to do what you need to do to get to where you want to go. And that's the reality. It also depends too how resolved you decide you want something to be, because lots of times people will decide that maybe there's still some things that are still bothering them, but they kind of feel like, you know what, it's good enough. I'm like ready to let those lie right now. I don't feel like I need to address them. I've addressed the worst thing, the first thing, like one or two really big other things, and that's enough. I don't need to do all 100 on the list. So yeah, so it's not easy to give a clear recommendation on that. There are different lengths of time too that an EMDR session can be scheduled for. Different clinicians do this differently. At my clinic, we tend to offer, we recommend the 1.5 hour session, which is really like 1 hour and 20-ish minutes, 1 hour and 15 to 20 minutes, to leave the clinician time at the end to do all the administrative stuff. Because that's what EMDR was built for, and that really allows time in the session to kind of like contain whatever might still be kind of stirred up, and like kind of make sure there's some opportunity for grounding and stabilization, that sort of stuff. But lots of people, for different reasons, prefer to do just the 1 hour sessions, like 50 minutes usually for clinicians. So that's also possible. Sometimes it feels a little bit rushed. And I would say for me, I don't think it's the very best option, just because when you do those shorter sessions, you're also kind of like losing more time in between sessions, because when you have a short session, you do what you can do. You're probably not going to complete things. And then you're going to come back at the next session. The first thing you're going to do is you're going to check in for about 10, maybe 15 minutes about like how have things been since, what's changing, because outside of EMDR, we're asking people to pay attention, to kind of reflect and notice if there's changes in behaviors, new memories, new insights, some dreams, like what's happening between that seems somehow related at all. Bring it back so we can check in on it. We're also checking, like, when you think of that situation now that we worked on last time, where are you at? We might need to go back and try and like desensitize a bit more or reprocess a bit more. So when you have 50 minutes and then you come in and use the next session, like 10, 15 minutes of that time to do that check-in, you're losing some of the traction that you otherwise could have had. And also life is interfering in the meantime, right? So in my opinion, it is better to do those slightly longer sessions where you actually have more than likely the time to actually complete something. And if you are doing the check-in from stuff from the prior session, well, you always do it, but like when you're doing that, it's not going to take as much of a chunk of the entire session. So it's just better in terms of the timing. My clinic, we also offer 3-hour sessions, and that's sort of a way to if you had several targets and you wanted to kind of like move through them quickly, then again, you don't lose that check-in time between. You get to have a longer session overall. And that's fine. The reason a lot of people won't choose the 3-hour session is because it may not be covered by an extended benefits plan, but you kind of have to pick and choose, right? Like what really works for you, and you have to check with your insurance provider and all that sort of stuff. That's a whole other subject. Anyhow, so that's kind of what all that looks like. And I feel like that's probably mostly what I wanted to say, just in terms of like an EMDR 101 introduction to EMDR. If you haven't tried it, I do think it's worth trying out. It is good for, like I say, all kinds of different presentations. Lots of times people ask me, well, is it good for neurodivergent people or only neurotypical people? I've used it with both, and I just find it depends a bit on the person. There are very few people where I have found that EMDR has not been a suitable approach, or so very few people. It can be used with kids, although typically, again, that involves a little bit of additional training, and yeah, I think that's probably it. So anyways, hopefully that's helpful. Hopefully it's made some sense. I know it sounds like a little bit like, what are we talking about here? But the basic premise is that you have a list of targets that you're going to work through. You've done some good grounding, some good stabilizing, and then to work through those targets, you're going to get really, really activated at the same time as adding really, really high levels of distraction. And the brain is going to have to pick and choose what it holds on to. It's probably going to have to let go of parts of the situation, the memory, like that kind of stuff. And that's going to allow you to find ways to move forward with it not bothering you the same way anymore, and hopefully some different perspective about it, different way, like different story that you tell yourself about it. If you have any questions about any of this, please let me know. I will do my best to try, and I'm going to try and post some other specific videos here as well that are even like further information on EMDR. And I'm also not talking about EMDR intensives in this video, but I will try and talk about that in another video as well, just so that there's a lot of information out there about the different ways that we offer EMDR at my clinic. All right, thank you so much for sticking with me through this. I hope it's been helpful. And like I say, please send your questions. Take care.